Hi folks, time for another COVID in Cobb update. We travel down to the headquarters of Cobb and Douglas Public Health on County Services Parkway, as we've done for many weeks now, to talk to Dr. Janet Memark. She is the director at that facility. When we last talked to her, we were concerned about a Labor Day spike in COVID cases in Cobb. It turns out it's been more of a plateau in Georgia, and here in Cobb, the numbers continue to head in the right direction.
We've passed the 19,000 mark, so it's steadily kind of going up, but not as rapidly as previously. So right now we are at 425 deaths for Cobb County. But that has slowed dramatically. I looked yesterday at the charts, and we definitely had a high steep incline, and then now it's finally leveled off and getting back down. So that's good news, and that's all from the July surge that we had. Right now, though, the good news is that Cobb's numbers are looking at, yesterday when I looked, it was 136 per 100,000, and that's fantastic news. So we're definitely going in the right direction. So we are still in high transmission, but it's definitely in a more contained state. So we had talked previously, when it gets too high, 300s, 400s. I mean, we definitely as a community feel it. So you can feel that people are being quarantined around you, and people that are getting it, so you kind of feel what's happening. Right now, we're able to contact the cases right away and be able to isolate them and get their contacts, their close contacts, and quarantine. And what's so important about that is how we keep the disease from spreading quickly. So, we may, the goal is always to have no transmission, but if we do have some transmission, to be able to contain it and control it quickly will mean that we can continue about our daily activities the best that we possibly can.
And I'm told this is normally a very busy time for hospitals in Cobb and elsewhere here in the Southeast, and we're worried about that mixing in with COVID.
Our hospitals traditionally are very, very busy here in the area. So our largest hospital is busy right now. Throughout the district, we are having some shortages in the critical care beds, but they do turn those over, and so they are able to keep up. So that's reasonable. The medical surgical beds are doing a little bit better, but the good news is that they're not filled up with COVID patients at this point, and so that is very good news. So it's corresponding with what we're seeing in our community as well, that COVID numbers and COVID patients still remain relatively low, although we're in high transmission, but relatively low for the hospitals.
Another somewhat strange thing is that the number of people wanting to get COVID tests continues to be kind of on the low side for some reasons. And part of that may be, at least Dr. Memark thinks, because of some confusion over who needs to be tested.
So testing still remains a little low, and so that means we have a lot of availability. So that's good. So if you need a test, you'll be able to get a test. And there was some previous confusion about when to get a test, like if you were a close contact, and I know CDC's guidelines had to be clarified. So we've stayed the same throughout that. If you are a close contact to somebody when you were with them for greater than 15 minutes and less than 6 feet, it is recommended that you get tested at day 10. Now, there's lots of caveats to that. Like if you had symptoms and you think you might have been the person that potentially had given the person the virus, or you developed symptoms quickly, go ahead and get tested so that you know exactly what your status is. Even though testing numbers are low, we are ready for a surge if one comes about, and the positivity numbers are hovering about 4 to 4.5%, and that is excellent. So you will remember we have been over 20% positivity when we had our surge. And so right now we are at about 4.5, and that's great news. It means that we're doing the right thing, and we've got to keep going.
And even though the COVID numbers look better, it is more important than ever, Dr. Memark says, to get that flu shot.
The Southern Hemisphere in Australia and different places, they're still showing that the flu season was very successful, meaning that they did not have a huge surge of flu this year. So that is great news for us, and there's several things that could be at play. So one is having a high vaccination rate, and so our vaccination rates, we're getting those numbers now, but they have not been extremely high. So we need to try to vaccinate as much as possible. So it's not 100% coverage oftentimes, but it gives you enough coverage to be able to protect the community and protect the hospitals from being inundated. So get your flu shot as soon as possible.
And then there is Halloween, something we're talking about in our subdivision, and a lot of people are talking about how to celebrate, how to handle Halloween this year. And Dr. Memark says, much like 2020, it should be a Halloween like no other.
Yeah, so Halloween. So this is going to fall right in our COVID season and our flu season. And so like everything else, we have to have some modifications to make sure that we're safe. And so CDC does have some guidelines that are out. Traditional trick-or-treating and Halloween is considered a high-risk activity, and so you're going to have probably large groups of people that will be in close contact and then coming in contact with people that are giving out candy. So think of different ways, like how can we spread out these groups a little bit? How can we decrease the interchange between people? So some of the suggestions that have been made is having drive-through or drive through the neighborhood where there's a one-way kind of candy distribution after people wash their hands or sanitize. Having it spaced out on tables so people can just grab and go, and you don't have to wait together for people to answer the door and then to come and then to give the candy out and things like that. So try to be really creative about these things because it can still be fun, but it can also be a little safer. The other suggestions were having like family pods and your close friends, like we all probably have some people that kind of have the same behaviors that we have and feel comfortable being around them. Trying to keeping it to small groups of people that are within your kind of personal sphere. That's a less risky activity. I want to make sure that people knew too that masks are still definitely encouraged. So the cloth mask or fabric mask, do not put your costume mask over your fabric or cloth mask. That can cause some breathing troubles that you may not be aware of, and so please be mindful of that. Your costume mask does not replace your cloth or fabric mask. So Halloween themed fabric or cloth mask are what is suggested for these costumes.
All right, so we follow up Halloween with what? Thanksgiving and then Christmas holidays, the Jewish holidays as well, and a lot of people are making plans for those holidays right now, and Dr. Memark says you should make those plans with COVID in mind.
If you're like me, you're probably looking at your Thanksgiving and Christmas schedules right now and planning that. And I know a lot of us have not seen our friends and family in a really long time. So as you're doing those, the planning for that, I wanted to just kind of put some things into your head to be thinking about during that time. And so one thing is if you have people coming in from different areas or you're going to different areas, please take a look at the transmission rates that are happening. We have 22 states right now that have surges that are currently happening. When we experienced our surge, we had a lot of people that were coming in from places that had extremely high levels of COVID, and they definitely introduced it into our community. So take a look at those things. There are different things. You can look at the CDC website about how to kind of protect yourselves. If you are doing an outdoor thing versus indoor is much safer. Especially if you're going to have your elderly, family members that are there, there is some kind of modified quarantines that people can do for the first 2 weeks previous to coming to visit. So if you're going to go see your mom or your dad, you might want to make sure your family is not out and about and really congregating for the 2 weeks before that, and then maybe get tested to lower your risk if you plan on doing those things. So take a look. There are some things that you can do to lower your risk and make it as safe as possible, because this is where we definitely see a lot of cases come from, is when there's congregations of people that are coming together. So please take a look at those things.
And so finally, the numbers, they are getting better here in Cobb County, even more than the state of Georgia. And Dr. Memark says that's primarily because people have been taking the precautions, those 3 W's, and she urges people to keep doing it.
We are still in high transmission, which means that the virus is alive and well in our community. The reason that it hasn't taken over and we have not had a huge surge is because of our own behavior. And so we have been great about wearing masks and socially distancing and not congregating together. But we need to be very careful. There are a few things that are going to be happening soon that we all need to be aware of that is going to impact our community. And so you cannot let your guard down. If we let our guards down at the same time as, fall break is happening, and then students will be returning to class. And that's what we all want. We do want children to be back in class for face-to-face learning, but that means that we're going to have a lot more people that will be congregating. And so two of our largest school districts will be having some face-to-face or increase in face-to-face starting October 5th. So please, please, do not let your guard down. Do not throw caution to the wind and start getting together with everybody and not wearing masks, because we have a situation where we're introducing a lot more people into our community that will be congregating. So we really need to do our best to make sure that we don't lose control of this situation.